Hey, Autoimmune Warriors, welcome to the Stronger Than Autoimmune podcast. I am so fired up for you to be here. If you're navigating life with an autoimmune condition, you're in the right place. I am your host, Des, and I am not just a podcaster. I am right here in the trenches with you as a fellow autoimmune warrior. We're diving into real, uplifting stories and some seriously smart expert tips and simple lifestyle tweaks that can make a difference in how we feel day to day. Now I've got to give a huge shout out to my amazing listeners. You're the heartbeat of this podcast, and I'm so grateful for you tuning in. If you're loving the vibes, here is how you can keep the love flowing. Drop a rating on Spotify, share a quick review on Apple, or pass this episode along to a warrior buddy who can use a boost of hope. Here are some patients that are killing it for our community. Workers with Autoimmune Ailments Alliance. These folks are fighting the good fight for students and workers like us with autoimmune conditions. Want to get involved or learn more? Swing by WAAA.org. They'll love to have you. Leapcure. They're all about hooking up patients with cutting-edge clinical trials and putting our voices front and center. Check them out at leapcure.com. Adapt Naturals by Chris Kresser. They offer nutrient-packed supplements based on science. Snag 20% off your first order with my code DEZ, D-E-Z, at Adapt Naturals. From my heart to yours, I'm sending you nothing but love and good vibes. Let's dive in together. All right. Well, welcome to the Stronger Than Autoimmune podcast. Today, we're joined by Dr. Jeff Gross, a board-certified neurological surgeon and founder of Re-Celebrate, a leader of regenerative medicine and anti-aging. With a biochemistry degree from UC Berkeley and an MD from George Washington University, Dr. Gross completed his neurosurgery residency at UC Irvine and a fellowship in spinal biomechanics. Practicing in California and Nevada, he specializes in spine procedures, athletic injuries, and longevity consultations. Dr. Gross pioneers activated NK cell-derived exosome therapies, offering innovative, non-surgical solutions for cancer, autoimmune diseases, and inflammation. Let's dive into his groundbreaking work.
Thank you. Wow. Well, thank you for having me. It's my honor to be here with you and other autoimmune warriors.
Yeah. So can we, I guess, not really start from the beginning, but really try to figure out how you even got into the science of regeneration? Because you came from neurosurgery and athletic injuries, so it's
it's a yellow brick road kind of story. You're doing one thing and it takes you somewhere else. So I'm a neurosurgeon and a recovering one at that. So I took care of many brain and spine problems over the years, and it was my patients who encouraged me to look into and include regenerative medicine to my practice. So many patients had disc problems, pinched nerves, things like that, but they just didn't want surgery. And I like that spirit. I didn't want to have to give them surgery because that's the absolute last thing. And the surgeries we do really haven't changed in 75 years. Maybe a little new, smaller incision, new widget, new metallic implant or something, but in the big picture, it's the same thing. It's a remodel of the spine. Well, couldn't there be something less invasive that might help better without so many cortisone injections and things like that? So my patient said, I'm not ready for surgery, but the other things aren't working. How about lasers? How about this? How about stem cells? And you hear that enough times, and chance favors the prepared mind. Luckily, in my undergraduate days, I studied molecular cell biology at Berkeley, and I whisked off to med school and sort of left that behind, but I always loved it. It was always something that I enjoyed, but I really didn't sort of apply on a day-to-day basis much, So when I noticed this sort of distasteful annual meeting of neurosurgeons where they just pat themselves on the back for doing the same thing over and over again, I stopped drinking the Kool-Aid And I went to some different things. I re-educated myself, went to stem cell conferences, did training, and did my own research on this. And I had always had that in my background as well. So that's where I really dove in to add regenerative medicine. And I'm saying that broadly, and hopefully we'll dive into it. But I went into that to help my spine patients. But I'm doing so much more than treating spine patients now. I'm sort of more of a general concierge level regenerative doctor. We treat all kinds of different things, spine included. So regenerative medicine is taking advantage of what we've learned that stem cells do for us. So stem cells create us from an embryo into a fetus to a baby to an adult, and then help maintain and protect and replace and restore us until too much inflammation accumulates. And I'm sure that will circle back into the autoimmune in a bit. And our stem cells just can't keep up with us. They can't repair enough. They can't regenerate enough. They can't replace enough. So how do we use that knowledge to strategically reapply regenerative stem cell type things to us? Because those cells produce things. They produce signals, molecular signals, in a couple different ways. One, through the production of growth factors, and these growth factors are synonymous with anti-inflammatory peptides, because when they influence neighbor cells, so if you put a stem cell in and that stem cell gets to talk to all its thousands of neighbor cells. It's a bodily cellular signal, and its stem cells deliver the most optimal cell function signal you can have. And this is the good stuff. So it makes those cells make growth factors. Those growth factors are taken up by our cells. And then our cells can stop behaving badly, like being overinflamed, and they can be anti-inflamed, meaning they can function more optimally and do what they're supposed to do. Anti-inflammatory lifestyle and diet and mindfulness and all the things you can do to suppress inflammation is slowing the degeneration and the aging of your cells. And if you're overinflamed, then you have symptoms. And a lot of those symptoms are an overactive immune system, for example, right? So stem cell signaling gives off these growth factors. It also gives off small vesicles. For fun, we call those vesicles exosomes. So regenerative medicine can be anywhere from using the growth factors, which you can derive in a little bit of a concentrated way from platelet-rich plasma, PRP, comes from your own blood. But if you're inflamed, you're putting that old oil back into the car when you're doing an oil change. Doesn't make a lot of sense. And then there are stem cells. Now, you can get stem cells from your own body, or you can get them from a donated source, like a mother just delivered her newborn baby. Congratulations. Hey, we were going to throw away your amniotic fluid and your umbilical cord. Can we have them? So what used to be trash is now treasure. That's really the best way, because that's a youthful, unadulterated, tested, clean source. We can skip ahead and just go to the growth factors and exosomes, which comes from amniotic fluid. So those are sort of the applications and how we take from regenerative medicine and use it strategically to help our cells function better when they're not able to do that on their own.
So really, does your body have to match where you're getting the embryonic fluid from?
Nope, not at all, because embryonic fluid is and stem cells and exosomes are what we call immunoprivileged, meaning they get a free backstage pass. Come right on in. We're not going to give you any trouble. They don't have a lot of individualized surface markers on the cells, and exosomes have minimal markers. So the immune system lets them on in, and theoretically someone could have a response, a sort of foreign response, but we don't see that. And here's an example. A pregnant woman is getting a daily dose of stem cell derived growth factors and exosomes through her placental membrane into her body. And we know this because if you have been pregnant, or pregnant people, their hair is growing wonderfully, their skin is glowing, they feel great, their mood is good, they're busy nesting, right? It's a survival thing because they're about to have a young one they got to take care of. So they're optimally healthy, and they're getting a daily dose of regenerative medicine. Now the stem cells are too big to pass through the womb, and that fetus is made up. Part of the genetic makeup of that fetus comes from the father, and too much of that could cause a response, a rejection response. And there are conditions where that could happen.
That's amazing. I'm glad that you even mentioned. Usually you hear women glowing because they're just pregnant, but you don't really understand the reason why. So thank you for connecting that. And these activated NK cell derived exosomes, How do they help with the immune system in combating?
Right.
Role do they play with, like, because I know you do work with arthritis. So
Right.
could you dive more into that?
Yeah. So now we're making a little bit of shift into a specialized cell exosome, not just a stem cell derived exosome. So to separate those apart, stem cell derived exosomes are just uniformly anti-inflammatory. So when we see people with hyperinflamed states, autoimmune issues, infections that are known to have a prolonged inflammatory cycle like COVID or Lyme's or something like that, we generally use the stem cell derived exosomes for those people. And we have shown in many examples to suppress inflammatory markers, help get them off some of the pharmaceutical anti-inflammatories. Not that there isn't a role for those, but it's nice if you can do this naturally, right? And improve symptoms, fewer flare-ups, Now, when we have people with increased what are called senescent cells or zombie cells, they age faster. And that can be a side effect of an autoimmune type problem or a hyperinflamed state. Cancer is one of those, right? You can develop cancer if your cells are overinflamed all the time. And you probably know that people with autoimmune problems have an increased incidence of cancer because their cells are just in trouble all the time. So it's important to, do all the things in your lifestyle, from sleep to diet to supplements to, exercise, to help suppress your inflammation. But regenerative medicine and the stem cell derived exosomes, for example, can help that. Now, if you're already having reduced immune functions as a side effect of that hyperinflamed autoimmunity, there's a certain part of your immune system called natural killer cells, or NK cells. And those cells have a very specific job in the body. They go around and remove abnormal cells. I mean, really abnormal cells, because we accidentally make genetic mistakes all the time. But these cells their job in a healthy person is to remove those cells before that cell can set up shop and cause a tumor or a cancer. They also remove damaged age cells called senescent cells or zombie cells. And the more senescent zombie cells you have, the effectively older you are at the cellular level. Even though you might be, 49 on your birthday, your markers in your cell might make you look 75. You have tests for that. They're called biological age tests. They look at how damaged and inflamed your cells are. Well, we can use these natural killer cell derived exosomes, they're very specific, and use them strategically to help people fight cancer, to help people who've had cancer, who got it treated, to stay in remission, to help people slow the age-related process at the cellular level. Some studies with natural killer cells show that if you give natural killer cells for up to 2 years, you can have reduced age markers that are found on these zombie cells. So aside from cancer, you are physiologically slowing the age process. And that might be more important in someone with an autoimmune issue than in anyone else.
And please explain why you think that those are most important, or to start targeting those cells for people that have autoimmunity.
Well, sadly, autoimmune issues cause the body to have more oxidation and inflammation at an accelerated rate, which is an acceleration of the age-related process at the cellular level. So we need to do anything we can to help those people slow the age-related process. Not that we wouldn't do that for anyone, but it's all that more important in someone who's already at a disadvantage. They're deteriorating at the cellular level faster than the average person.
Yeah. So is there a natural way? I know you said these zombie cells are detoxed or removed from the body. I mean, once you insert, I guess there's a before and after. There are the people that aren't able to remove these, but what are the mechanisms in our own body that people that don't have autoimmune disease are able to eliminate these?
Well, we all have some natural killer cell activity. People that are found to have cancer have a reduced natural killer cell number and function. What happened first? Did the natural killer cell function come down, which allowed the cancer to happen, or did the cancer somehow escape that mechanism and then the natural killer cells got suppressed? We don't actually know that yet. Exosomes are a lot easier as an off-the-shelf treatment, and they travel better through tissue. That is the most natural thing you could do. And you can increase your own natural killer cell activity, and that would be through hormesis.
And what is hormesis?
Hormesis is a slight stress on the body to build cellular resilience. Examples would be fasting, 1 day, 2 days, 3 days, hot sauna, the real sauna, 175 degrees-ish for 20 to 30 minutes, 5 days a week, get that heart rate up, release those heat shock proteins, those growth peptides, release the stem cells. You could do high intensity exercise. I think that's probably the easiest and freest thing you can do, but high intensity, and it can be in bursts, and it doesn't have to be for an hour. You can get a great workout in 20 minutes. Cold plunges, a slight stress on the body that builds resilience without hurting you. You got to find the right balance. They're called hormesis or hormetic activities.
But there's no really, with going to somebody like you, you're able to really measure how much you're getting and what the progress is in your body. When you're doing these other types of things, you really don't know yourself. I mean, I guess afterwards you could kind of say, okay, I kind of feel better, but I think it would have to be a repetitive process. And people that have autoimmune disease, I think, I know for me, doing HIIT exercise isn't an option. Cold plunges, I don't know if I would like that, but I think the only viable solution for me would be fasting, but there's no guarantee. Like, you don't know how much is helping.
No, you're right. And it's important to find the right lab tests that are out of whack and that you can do something, make a change, and see that lab test come back. That's part of it. The other part is how you feel. And like you said, that's a measure. And that, to me, that's probably the most important measure, because those lab tests at the end of the day are interesting to me scientifically. But if you felt better and you functioned better and you slept better and had the energy or whatever, that's a win. That means your cells are functioning better. And we start with the basics, lifestyle, you got to do the work. And then regenerative medicine might be the last piece you add. And everyone's different. We do consultations far-reaching across the globe for people. A lot of what we do is remote, and they only come here to our clinic in Las Vegas, Nevada, if there's a reason to come.
That's awesome. And then, of course, they would have to travel to Nevada to get the actual therapy. But can you talk about, other than the consultation, once they go to their office, what can somebody with arthritis or immune activity expect once they start working with you?
Well, anything in regenerative medicine, we're not yet approved to make marketing claims. So I want to be upfront about that. That doesn't mean it's unapproved or disapproved. It's just not evaluated yet by the government. So I can show examples. I can show you the research. I can show you the medical journals I base what I do on, because we're not just shooting from the hip. But, typical results would be improved pain because the inflammation is suppressed. And with improved pain, you have improved function. So, for example, I have a sweet woman who's over 80 who has really bad arthritis of her hands and can't do her crafts. She likes to paint rocks. She comes in once a year and gets an IV of stem cell-derived exosomes. It helps her significantly. The first time she had it, she said, "Great, I love this. When do I need to come back?" And I said, "As soon as your symptoms start to come back. Enjoy this as long as you can." And it was like over a year before I heard from her again.
Oh, that's amazing.
And everyone's different, though. People don't mind coming here, see a show, have a nice dinner, enjoy the town, and then get your treatment.
I was just there. I should have stayed.
Could have. Yeah.
Okay, so I'm glad that you got into the science of it. And I know we talked about how people that have autoimmune disease have a higher risk for cancer. What challenges do you have in working with natural killer cells or working with these cancer patients?
We really don't have big challenges, since this is such a natural, easy to receive treatment. If people actually have cancer, sometimes reaching the cancer can be challenging. So some of what we do is intravenous, an IV drip. Some of it is injected into the tumor itself if they have a tumor. And some of the tumors are difficult to reach. Luckily I'm a surgeon, so I can get to most places, but not all places. And that seems to be our challenge. The biggest challenge is getting these, we call them biologics, getting a hold of the actual, exosomes and things. We have a very limited number of doses of the NK cell exosomes. We have plenty of the stem cell derived exosomes because that comes from amniotic fluid here in the US from non-COVID vaccinated mothers who are screened early, they're healthy, they're on prenatal vitamins, they're screened at the time of delivery. Then the fluid goes to a lab, which is FDA certified and compliant. They test it all again. It's quarantined for 2 weeks. Make sure, it doesn't have any viruses or infections. And then they're made available to us to purchase.
Yeah. Because you mentioned that you have a shortage, or you had to wait a while to get some of your product?
For 20 plus years, professional athletes from the US have gone to Europe for treatments using stem cells and regenerative medicine. We are now, we have that in the US. I'm not the only clinic. There are plenty of them. Might find someone in your city if you're not near us, but look around and find someone who will individualize your care if you're shopping them.
Yeah. So how would you shop if you were somebody that was sick, had cancer, autoimmunity? If you were in my position, how would you make sure that the doctor they're going to is credentialed or know what they're doing with regenerative medicine?
I would interview the doctor and see how you feel. That you're going to get a gut feeling. This is true for any doctor at any time or any professional you may deal with. And then, see how many people they've treated and see what the results are like and how reasonable they are. If they over advertise what they can do for you, it's probably not the right person because they're overselling it. None of this comes with a guarantee. Truth be told, nothing in medicine comes with a guarantee, right? So you can also see how long they've been doing it and what the reviews are like online. If they have 5.0 stars and never had anything less, you always wonder about that because that's inhuman, right? Everyone has one patient that's not happy. So it's kind of like an Uber driver. They all seem to have 4.95 and above. It's natural, it's alternative, and it's coming for prime time. It's going to be, at the end of the day, probably the best alternative for people dealing with a hyperinflamed state, an autoimmune state.
Yeah. I know you're really into biohacking also.
Yeah.
If you can give some pointers other than the regenerative work that you do, I know you talked about fasting, cold plunges, anything else you think that can help the body hack or biohack?
Yep. Well, you have to have the groundwork first. You have to have the sleep hygiene. You have to have, the exercise piece. You have to have all the pieces to do everything you can without having to, have medications if possible. Then secondly, the foundations of suppressing inflammation in medicine would include making sure your hormones are aligned and optimized. And even some young people their hormones are thrown off. And sometimes if your hormones are off, you'll be hyperinflamed because that's your body's final common out of whack pathway. Right. And at the end of the day, you got to look at your nutrition and your supplements. I mean, our nutrition in the US isn't great. Even when you try real hard, we're exposed to seed oils and preservatives and pesticides and things like that. So unless you've got your own organic garden in the backyard and you're only eating from it, it's real tough. So why do we take so many supplements? Why am I showing you my daily bag, my little Ziploc of lots of supplements? It's because we just don't get that in our daily diet, and our cells want that to be optimally disinflamed. So you got to do all that work, and then if that is not enough, then you look at maybe, should I try regenerative medicine? Do I need to look at stem cells, exosomes, NK cell exosomes? There are different things. And I'm just scratching the surface of regenerative medicine with you today, Desiree. There's so much more we don't have yet here in the US, but we will.
And I know, going back to showing your supplements, you have a PDF that you can get on your website that shows you different things you can do to help your body.
There is that. And I start out with what I call the anti-inflammatory starter pack. So if I can just throw this out there, if you really aren't taking supplements and you want to start suppressing your inflammation, you've got to take your omega-3s. And that is, I'm talking about 3 grams a day, 3,000 milligrams a day. That's probably 3 pills spaced throughout the day. You need a good probiotic. Let your bacteria that live in you help you. They will do that. You need really good sleep and at night, because you repair at night. And if you can't repair well, you're going to be more inflamed the next day. So that would include melatonin and magnesium. That's a great nighttime combo with your last fish oil. The melatonin, though, if you take a pill or a capsule, you're not getting much. So I recommend a dissolvable at night. Let it dissolve under your tongue. And then, the vitamin D, which I know you've had a guest call it the hormone D, and that's accurate. It is the only vitamin that's a hormone. Vitamin D3, you need at least 10,000 international units a day. And even then, some people don't absorb it well. I'm one of them. I've taken 10,000 forever. I still struggle to get my vitamin D level up. I have to do an injection every week to do that. Vitamin D suppresses cancer, suppresses inflammation, suppresses all causes of mortality. If you're suppressing all causes of mortality, it's a longevity supplement. So we should all be on vitamin D3. You should check your levels. The lab level is inaccurate. The lab level says, I think it's like up to 100 is the normal level. But that's just the level not to get rickets, not to be low. The optimal level is probably 125 to 150. So push yourself, go a little bit above, do a little extra, as my friend would say.
Yeah. Thank you so much. I know you keep on hinting at you're just at the cusp of regenerative medicine. Can you share what you're looking forward to at your company?
We're celebrating the renewal of your cells here at Recelebrate. Well,
I love that name.
Thank you. Yeah, listen, we're looking at, we call them designer exosomes. So this will be mitochondrial stuffed exosome to improve, maintenance of muscle mass. We're looking at different exosomes that help stimulate bone density. Longevity is correlated to the amount of muscle and bone density that you have. We're highly focused on other sources of exosomes like bone broth, like colostrum, like plant-derived exosomes. So we've actually come out with a new product called Longevex for exosomes for longevity, and it's basically from curated organic Italian fruits. You can replace a lot of your phytonutrients in your supplement bag, like I have, and just take one capsule a day. It helps reduce reactive oxygen species, which is one way a biochemist speaks to reduced inflammation. So plus it delivers this at a 70x concentration compared to the natural fruit. Plus, it delivers it directly to the cell because it's exosomal, which is nature's liposomes. Liposome means a little fatty membrane that delivers it right to the cell. It doesn't get lost in the bloodstream. So this is not only highly concentrated by virtue of the amount of fruit it takes to make these exosomes or extract them, but it delivers it at a more concentrated way. So this is like, a really good anti-inflammatory boost for your cells. So it's Longevex, and we have that available. You can go to recellnutra.com, RECELLNUTRA.com, and give that a try.
Okay, yeah. I love all the tips that you've given us. Anything else that you want to share before we part ways?
Yeah, the exercise piece is probably the easiest thing people can do to suppress inflammatory cascade of activities. The muscles release a peptide when you exercise at good intensity called myokines, and those myokines go to the brain and help prevent dementia. They go to the rest of the bones to help support muscle and bone development. They go throughout the organs. They suppress inflammation through the same pathways, because this is about the root cause. The root cause is suppressing that inflammatory signal in the cells that tells the DNA what proteins to make. And if the DNA is making inflammatory proteins, you don't want that. You want the ones, your DNA focused on other things. You've got genes for both. You've got genes for bad news and good news. You gotta really support the good news.
Yeah. And I can see that you really are excited about the new things coming up, and you seem very healthy. You seem vibrant. So whatever you're doing, I guess we all need to do it.
Yeah. Thank you so much for that. Yeah. I mean, you got to do the work. So you got to exercise, you got to eat right. No one's going to eat right 100% of the time, right? That's no fun, right? Okay, we have pizza day too, but we don't do it every day. This is a little different, but the omega-3, the 3 grams of omega-3 a day will help forgive a lot of inflammation that you may have brought on yourself. The smokers who take 3 grams of omega-3 a day can help reduce their higher risk of lung damage and of cancer and things. It almost helps them forgive. So exercise and the right supplements can help you forgive a lot of bad things we did.
Thank you so much.
Happy to do it.
Guess who I just connected with, warriors? Leapcure. Leap what? Leapcure. Leapcure connects patients with clinical trials to make research more equitable and efficient. Listen to their latest clinical trial.
If you've been diagnosed with thyroid eye disease and are seeking potential new treatment options, you might be interested in the LIDS clinical trial. If you're 18 and over, have a diagnosis of Graves' disease or Hashimoto's, and are interested in potentially participating in research, you can fill out a short questionnaire at lpcur.com/TED. You'll be connected with someone on the team to determine whether it might be a good fit for you. Check your eligibility and learn more at lpcur.com/TED.